record, and I'll share my screen. All right, and we'll leave it there. All right, guys, welcome to this presentation here where we're going to be talking about injuries, and we're going to be talking about what you can do if you're in pain. So let's jump right into it. So I want to welcome Michael Ojea. Ojea, sorry, Michael, welcome to this little presentation.
Thanks for having me.
So Michael is doing his Masters of Health Science, and you are just waiting to do your last exam right now. And you've got a Bachelor of Clinical Science. You've done some coursework in psychology. You're previously a massage therapist and a personal trainer and a fitness instructor. And you're part of the team at Berwick Osteopathy, and that's in Melbourne's southeast. So you've done quite a lot here, bud. Is there anything we missed out on?
No, that was a perfect introduction. Thank you.
Mate, let's talk about pain and injuries. So,
let's do it.
Starting with this disclaimer here, we are not your healthcare professional. So if you're watching this video and you are experiencing some pain or some injury, please go and see a registered healthcare professional. Please don't use any information here to treat your own pain, because your pain might be masking a systemic or serious injury that you might need to get checked out and further investigated. So let's start by talking about what is pain. Now, this definition is from the International Association for the Study of Pain, IASP, and pain is defined as an unpleasant sensory or emotional experience associated with actual or potential tissue damage, or described in terms of such damage. So Michael, can you speak a little bit about pain? You know, what is it in our body?
I think pain is like a protection mechanism. So pain's there to tell you that there's maybe something not quite right in the body, and it's designed to kind of motivate us to do something about it. So it tells us that we're in potential danger or in danger, and we need to protect ourselves or maybe change our environment, change our circumstances.
Yeah. Okay, so it's kind of like an alarm system, right?
Correct. Correct. So pain might mean that you've actually hurt yourself. So, you know, you let's say, take an extreme example, you break your arm, you're in extreme pain, or you may think you have pain. So the best way I like to think about that is you're going for a walk, and you feel a little niggle in your foot, and you're like, what's going on? And as you walk longer and longer and longer, you start to feel more and more pain. So you go, okay, let's have a look. And you take off your shoe, and all you see is this little niggling, like little pebble. And you take the pebble away, and you put the shoe back on, you start walking again, and all of a sudden the pain's gone. So there wasn't actually any tissue damage per se, but you were still feeling pain. So it was an alarm system by the brain to be like, there's something not quite right here, and you were motivated to have a look, take your shoe off, and make sure nothing was harming you.
Yeah, I think that's sometimes interesting as well, because like with that analogy, you might take the rock or the pebble out of your shoe, but then when you put the shoe back on, you almost have this lingering perception that the rock is still in your shoe. And you're kind of like, oh, something's still not quite right, even though you've assessed the danger of this pebble. The pebble's gone, but then you're still thinking, oh, like, it feels weird. And I think that's sometimes where we get caught up with pain, and sometimes pain can be a misconception because it's the real definition here is potential tissue damage. So it's an alarm system that there's tissue potentially damaging. And I think this is really important, because if you want to touch like a hot stove, you want that feedback to go, oh, it's hot, I'm going to move my hand out of the way. And if you didn't have that pain warning symptom, you'd have your hand there and you burn your hand. And that's the same with, let's say, exercise. If something was not quite right in your back, for example, when you're doing a deadlift, and the alarm system wasn't there to indicate pain, and you kept on doing the movement the way that you're normally doing it, that could then lead to more and more potential damage through the structures in our body through that movement system.
Absolutely.
Let's talk about some things that could modulate pain. So modulate pain is just to, I guess, change the level of pain. But Mick, do you want to tell us a little bit about some things that could change your perception of your experience with pain?
I think it's past experiences play a big role. It's like, okay, like you did this deadlift this one time and you strained your back, and maybe you went and got an image and you found you had a little herniation. Really common in a lot of people, but you've read the report and you're like, oh my God, I've got a disc bulge. And so now you believe anytime you do something to your lower back, that it's my disc, I've hurt my disc. And realistically, maybe you're just a little sore, or maybe that one day it was just a bad lift, and you've just niggled something, but your belief and your perception around your back that you've hurt something makes and amplifies that pain quite a bit.
Yeah, I really think that perception and beliefs is probably the big one, this first one here, because I think your understanding of what's happening in your body is a big role, especially if you know someone who's maybe gone through something similar. So using that example of that lower back pain, you might have a lower back issue, but then your cousins, friends, neighbors, gym buddy had a similar experience, and they're using really strong language like, oh, I've slipped the disc and I need surgery and I'm stuck in a wheelchair and that's it. I'm done, or I can't exercise anymore. And it's really like strong language and beliefs around that. So then when you experience any sort of lower back pain, if you did a similar movement to your, what was it, cousins, friends, neighbors, gym buddy, then you might start associating and going, oh, like that's what happened to that person, must be happening to me too. And we make this false connection between the two.
And I think like often people, let's take something like osteoarthritis, which is just normal aging, right? And people are like, oh, bone on bone, like my knee's degenerated, and what happens is a little bit of discomfort as maybe you're warming up turns into this pain. And it's like, well, it was just a little bit of discomfort. Exercise is really good for something like osteoarthritis, but because you felt this discomfort, you think that this is only going to damage it, then all of a sudden what was just a little bit niggling turned into pain. So yeah, our beliefs and our perceptions around our body play a massive role.
Yeah. Next point here is stress and anxiety. So we know that when we are experiencing higher levels of stress and anxiety in our lives, when there's with this concept of fear or threats around us, we feel this heightened level of stress. And you might be experiencing it right now because what's happening at the time of this recording is the COVID restrictions and such. So you might be experiencing more stress in your life. You might be gripping hold in more areas. So then your perception of that pain changes, either heightens, or it can go the other way as well. In levels of stress, you might not even notice that you're in pain until things kind of calm down. So that can modulate and change things around.
Absolutely. Yeah, I think stress and anxiety they heighten our mood. So if you've hurt something and you start to feel stressed, you pay more attention to it and you focus more on that. And if you focus more on something, you notice more of something. So yeah, stress and anxiety definitely play a big role in how you perceive pain. Absolutely.
Yeah. So closely linked to stress and anxiety would be sleep. So we know that poor quality sleep can affect our overall mood, our overall experience with our emotions, and in amongst that is stress and anxiety. And then it can also make pain symptoms worse. And then that final point here is our diet and nutrition. So if we are eating poorly, if we are malnutrition, or not hydrated or anything like that, that can add extra layers of stresses in our life and increase our perception of pain. The last thing I wanted to touch on was, I guess, our environment, which is probably the biggest role, and I guess the people around us. And maybe an example you might experience watching this is you in the gym. So depending on who's around you in the gym, if you do a certain movement and let's say you're on a bench press and you hurt your shoulder for some reason, depending on who is around you, let's say you've got your buddies spotting you, you might act a different way to if you have, maybe a random person come and spot you. Or maybe if you're a guy and, there's some girls in the gym, you might behave differently than if, nobody else was in the gym. So the environment around you really quickly modulates your pain, especially in that really acute phase.
Yeah, absolutely. Like I like to think about, what can modulate pain as like a cup, and, we will have a certain limit of like what's in our cup, and it's like, okay, like I've thrown in some deadlifts, I've got a little bit of muscle soreness and some like joint pain and maybe some inflammation, but your cup's not completely filled. Then you start to throw in pains and beliefs and stress and poor sleep and poor nutrition, all of a sudden your cup is spilling. And all of a sudden what turned from a niggle, really increased your pain, and you're thrown in some environment and all of a sudden your cup's overflowing and it's like, okay, how do we address this cup?
I think it's interesting as well, because you can change the cup to maybe that idea of the straw that broke the camel's back, because you might have like lots of layers of things. Then all it takes is, I don't know, a dirty tea towel on the table for you to like almost break. And then, that's when your pain is amplified and everything kind of like almost like a waterfall just collapses. So yeah, I think that's a really nice analogy where, we want to try to manage our cup. If we can, try to like change what's in our cup, but be careful that our cup doesn't overfill, because that can be a slippery slope to other things.
I think it's about asking yourself, certain questions. It's like, okay, like what's in my cup? So the first thing is to identify it. So if you can identify some of these things, it's the things that you can address yourself, and that leads into that second question is, what can I change or address in my cup? Or, thirdly, how can I build a bigger cup? Now, I think most of the people in the challenge are building a bigger cup because, you're eating right and you're working on your diet and you're getting fitter, stronger, faster. So, I think you're all working towards a bigger cup. It's those first two questions of, okay, well, what's in my cup? What are the external things that are affecting it and filling it up?
I like it. All right, let's talk about some healing times. So this is just a chart out of a textbook, which kind of goes through what is normal, and I'm using quotation, normal healing times. So we could see that, on this top chart here, there's a couple of days to a couple of weeks to, a month to a year almost. But I think on average, we see that most things start to get better around this, 1 month, 2 month period. And depending on, what grade, so let's say a muscle, exercise induced damage might, or injury might last, a couple of days. If you have like a more severe injury, might last maybe a month, a little bit more, might be 2 or 3 months. Same as like ligaments, might be around that 2 to 3 month, bone injury around that 2 to 3 month. A tendon injury around that, 1, 2 months or so. Michael, can you talk about a few things that could alter or modify the healing time? So what things could make it longer for your body to heal?
Well, I think, we've discussed it. Sleep plays a big role because sleep is, part of our recovery. And then your diet and nutrition. So they're probably big things that can alter healing times. We know alcohol plays a role in delaying how we heal, especially in the muscle. But then, how we continue to train. So if we're experiencing a lot of back pain and we continue to try and do a PB on a deadlift every single time, and there's nothing wrong with a deadlift, but you're trying to load it up 1 week and then you're like, I can put on 10 more kilos, you're still experiencing pain, then you might start to, progressively extend that healing time or extend the time that it takes to recover. So, it might even be the same with, let's say you've hurt your rotator cuff, it's a little bit niggly, it's a little bit sore, and you just continue training and you just keep doing shoulder presses and keep doing lots of shoulder work and things that require a lot of stabilization. You haven't really allowed that to heal, or you haven't focused on any exercises to help strengthen that area. So you just keep adding stressor and stressor onto it. And yeah, it might heal over time, but it's just gonna, instead of 2 to 3 weeks, it takes 2 to 3 months.
Mm-hmm. Yep. There are definitely some genetic factors that can influence that, such as age. We know that older populations take slightly longer to heal than younger populations. And then, I think the big one would be your recovery principles, such as your sleep, hydration, nutrition, those sorts of factors that can influence it. But I think the main point I wanted to point out here was that normal textbook healing times is around this, maybe 1 to 3 months, this kind of area here. The body heals. And then the question comes in and goes, okay, well, we've all experienced or heard of somebody that we know who has experienced some back pain years ago, and they're still feeling the effects of it, 5 years later. Or they might have hurt their shoulder, and 5 years later, they're still feeling the effects of it. And I think this gets tricky because we go, well, textbook wise, you would have healed from whatever injury within that, 2 to 3 months. Yeah, you might have actually taken some time off. You might have like sat on a couch for 6 months. So, all right, your lower back would have healed. You weren't deadlifting anymore. But then, why are we still experiencing that pain is that big question. And hopefully we can get a little bit more answers here. So now let's talk about what to do if you're in pain. So I've kind of written out these 5 little steps to what to do if you're in pain. So number 1 is to not panic, because we know that if we panic, if we stress, it's going to make our experiences with pain worse. And that's if you are having an injury or if you're experiencing pain. Because, now we're starting to see that they're almost 2 different islands on their own. Next would be to rule out red flags. So things that are not quite right. So Michael, like, what are some things that could be a red flag? And if we use the example of maybe lower back pain, what are some things that could be something that's not quite right?
So something that's not quite right is you might feel, some tingling down the leg, numbness down the leg, potentially you have bowel bladder changes, you're getting pain at night. I think the big indicator for me of a red flag is you're not going in the right direction. So it's not getting any better. Nothing helps it. It's always painful. It's getting worse. And then you start to go, something's not right here. And I think intuitively, like a lot of us know when something's really not quite right, it's like, okay, like I'm losing a lot of weight, but I haven't eaten well, I haven't trained, my back is in a lot of pain, and you're like, okay, is something not quite right here? Do we need to go and get further investigations?
Mm-hmm. The next step here would be to move within your means. So what I mean by that is, I think a common approach whenever someone is injured or sore is to just completely remove all movement. So let's say lower back pain. When we are experiencing lower back pain, we might opt to sit on the couch and do nothing. When we know that you may benefit from being physically active, such as doing some basic stretches, very yoga-esque or Pilates-esque, you might benefit from going for a walk or even just doing some really light activities. But moving within your means will help to retrain the brain almost, that it goes, hey, like these tissues aren't damaged. So I think the main...
I think you and I are massive firm believers of, instead of removing something, we replace it with something. So it's like, okay, if it's not within your means to do a squat anymore, but you can replace it with a leg press, for example, then that's moving within your means, and it still allows you to train and to manage pain.
Because I think when we look at this injury and this pain, it's almost like this learnt experience. So our body detects pain. So then our body detects that there might be an injury in the body somewhere. So then we choose not to move. And then whenever we do some sort of movement, the alarm bells go off again. So we do any sort of little movement, alarm bells go off. And now it gets to a point where you're almost like blow on the area and the alarm bells go off. So we get really sensitized to it. And that's where I guess I like this image here, where on the left is, I guess, what we say normal. So this dotted line is when we experience pain on this alarm. And this is just our normal daily fluctuations of movement and things and life and stresses and all this stuff. Kind of like our cup concept that we were talking about before. So there's lots of room for activities and extra things in our cup. But then when we have a little bit of pain here, we could see this kind of line is heightened. So there's a lot less room or space in our cup for activities before this area becomes inflamed. So we want to try to find ways to move within our means, or almost to bring or empty our cup. And that's when we can start looking at some other modalities to get things to calm down. So we're trying to find things that fit within our room for activity, because we want to be physically active. We want our body to move again. We want to teach our brain that, hey, maybe all of our tissues are healed by now. It's been 3 months, all our tissues are back to normal, but the alarm bell, this connection between the two just isn't quite right. And we almost have to retrain. And we do that by graded exposure, like slowly teaching the body, hey, you can bend again, you can twist again, you can actually start deadlift again in these movements. So the next point here is to search for resources. So I think a big fear for many people is the unknown. So if you were to, I guess, quote, educate yourself with what's happening in your body. So if you are experiencing lower back pain, all right, do you know what the bones of the lower back look like? Do you know what the muscles look like? Do you know what the organs look like around it? Do you know how they bend and twist and move together? So almost kind of like getting some understanding of what's happening in your body is a good step. I think we need to be careful that we don't turn into Dr. Google, because that could be a slippery slope. And then finally, I would say number 5 is to seek help, which is where people like you and I come in, where if we are experiencing pain, something isn't right in our body, we want to seek someone who understands more about what's happening, right?
Correct. Yeah, absolutely.
Well, mate, let's go through some case studies now, some different parts in the body, and I think some steps that we can take to maybe minimize pain or to get in the right direction. So the first case study is kind of what we've been talking to a little bit here, is, just this idea of lower back pain. It might be maybe central, meaning the middle, or a little bit diffuse, or a little bit everywhere. And then let's say the pain increases with deadlifts. Now, I think, first of all, I'll say that it could be lots of different things, right? But, if we look at this image here, Michael, if someone comes to you and they're experiencing some lower back pain, it's kind of in this area where it's red, and they say it gets worse with deadlifts. What kind of things would you start to say to this person, or maybe some things that they could do to help improve their experience with pain in the area?
Well, I would start to firstly say, let's have a look, let's assess things. But, you'd reinforce that they're not broken, that, this is okay. And this happens with many people. And it's just trying to understand what's occurred here. So if we look at that picture, there's a lot of words there that things might have been affected. So maybe it was the facet joint, and you notice this slight pull into that back, and it feels a little bit locked up. And they usually resolve themselves in 2 to 3 weeks. So it's just it's a nice reinforcement to be like, it's okay. It's pretty self-limiting. So it's gonna resolve over time. I'm not gonna fix you. And most health practitioners won't fix you, but they'll give you the tools of, here's some stretches, here's some modifications to your exercise, here's some ways we can help strengthen that area to really help that area. Now, maybe it's a disc problem, and it's a little more acute, and it's maybe it's a little bit more severe, and it maybe possibly takes a couple of months to heal. Then we can start to look at different exercises to help that. But we need to be reminded that discs do heal. They're not slipped. They're not out of place forever. There's many research out there that shows that they heal. It just unfortunately has a poor blood supply, and so it takes a little bit more time. But you can take that time to strengthen that area, do some things that will help prevent that injury again.
Yeah. I think what you and I would help people with is to really understand why this happened. It's not necessarily normal for, a back injury to spontaneously happen, right? So we want to try to find out, why was the load through the lower back higher than what the capacity was? So that could be because there's maybe a movement dysfunction somewhere. That might be a really technical failure that happened during the lift. So let's say when you're deadlifting, you're not deadlifting, you're doing something else that isn't a deadlift anymore. So we ask, okay, why is the load through the back more than it needs to be? And we don't have that answer right now in this presentation. That could be very unique and specific to you, which is why you may need to work with a registered allied healthcare professional or like a personal trainer and go, okay, what isn't moving here? What should be moving? And then the other way, what is moving and what shouldn't be moving in the body through the movement? Let's look at another. Go on.
And I think that's really why you should seek someone, because heck, you may have done that technique absolutely perfectly with a deadlift, but your deadlift followed a really tough leg session the day before, and it was a loading problem. So, people that ask those questions, and it's correct. Steve is right. We need to understand, why did this happen? Because it's not normal just to pick something up and all of a sudden you're in pain. So, yeah, to paint that picture is really important.
Let's look at a different case study here. So let's go through knee pain. Now, knee pain, another really common presentation. And let's say, just general knee pain, maybe kind of where this reddish area is, and the pain increases with squats and lunges. Now, if someone presented with you and goes, hey, Mick, I've got knee pain, it's worse when I do squats and lunges. What's happening in my body? What kind of things, or what kind of questions would you start asking? What things are you starting to look at with knee pain?
We'd have a really nice look at, I guess, what's happened in that knee. So we'd assess all those structures that we can see there. You know, we can see lots of tendons, lots of ligaments, some connective tissue like the meniscus in there, and we'd also have a look at the surrounding musculature, what's going on. But we'd also have a look at the person as a whole. Like, you know, are they 70 years old with a little bit of osteoarthritis? And you go, okay, like maybe a really deep ass to grass squat might just niggle your knee a little bit. It might not, who knows? But we need to assess these things and have a really good look.
Mm-hmm. Yeah, I think that when we look at the knee, we can almost look at the knee as a very lazy joint. And what I mean by that is it's not really like your elbow. It's not really hooked in and connected. It's just kind of like, you know, one bone, two bones. There's some ligaments, there's some tendons, and they just kind of like sit and work together. And this is exactly what we need to survive. We need to be able to walk and twist and change direction. We need that flexibility in the knee joint to do life. But then it also creates a lot of load because, you know, we're controlling our body, we're moving around. So it's an interesting joint to look at.
And I think
we start to point the finger and we go, okay, we've got knee pain. Is it the knee's fault or is it something else? So
that's right. And you'll need Steve's 100% correct. Is it the knee, or do we need to start looking up and down to have a look? Is it the hip that's not quite functioning that the way you would like it to, and the knees, you know, waving the white flag, but it's actually the hip that's caused that pain? Or is it the ankle that's dysfunctional and it's from the ground up, and all of a sudden your knee is trying to compensate for the ankle's dysfunction?
Yeah, because the knee is really good at doing the knee's job and it's not very good at doing the ankle's job.
Correct.
And that's the same as like the lower back, where, okay, you're experiencing that lower back pain, but why is that in pain? Is it taking more load when it shouldn't be? And the same thing with the knee. Why is the knee sore? Is it taking more load than it should be? And we look at, you know, the structures. This thigh bone goes all the way up to the hip. We look at the shin bone, goes all the way down to the foot. All right, we need to start looking at these areas and go, okay, are they the ones that are causing that dysfunction in the knee? Let's move on. Let's look at the shoulder. So let's say someone has shoulder pain and the pain is worsened with overhead presses, and maybe, you know, it's in this type of area. What kind of things are starting to come to your mind with that overhead press, and if they're experiencing that pain with it?
The shoulder can be a tricky one because there's a lot going on in that shoulder. There's a lot of muscles that help stabilize the shoulder. So we have things like the rotator cuff, but, you know, we also know that the biceps and the triceps play a role in stabilizing that shoulder. And then we've got lots of ligaments and connective tissue in and around that area. So we'd definitely be having a look at, you know, how that shoulder moves and how that rotator cuff stabilizes. But then, you know, if you're getting pain in that overhead press, is it the shoulder, or is it that you've got a poor lack of mobility through, I guess, that mid-back or that shoulder blade or that shoulder girdle, where, you know, they're not moving well. So all of a sudden your shoulder's cranking into this position to really get that weight up. So it could depend on many different variables, I guess.
Yeah. I think the shoulder, you know, evolutionarily, is very flexible. It needs lots of movement. We need to be able to, like, you know, bend and twist and, you know, grab the branch and go for a swim and chase the deer and all the other stuff. So we have lots of flexibility. And you're right, there's so many moving parts. You know, we've got the scapula or the shoulder blade, we've got the clavicle or the collarbone here, and we've got the humerus bone all working together to create this shoulder joint. And if there's any dysfunction in, you know, this mid-back, this scapula, the clavicle, any of these joints, we're going to start experiencing that pain here. So there, I don't think we can give any answer about the shoulder, because we really need to find out, you know, why is it not quite right. Now, if someone is experiencing pain with an overhead press, I mean, we could always find another solution for that movement. So, you know, if they can't get their arm over their head, maybe they might be fine doing a lateral raise to 90 degrees, or maybe they want to prioritize, you know, maybe pulling motions, working the back of the shoulder, you know, like a face pull or a row, or even instead of doing an overhead press, doing maybe an incline press in this direction allows for some space to complete the movement. And we're still starting to overload the the muscle in the shoulder. So then we're getting some stability there. So there's lots of different options. But
Some people might, in the interim, may even use a machine. And look, I don't think we're the biggest fans of, using a machine because you lack stability. But maybe for the interim, whilst you're seeing someone and working on that stability, you might just use a machine to take that stability component out of it.
Absolutely. All right, let's look at case study number 4. So wrist pain. So this might happen when you're doing a push-up or a plank or any sort of body support position. If someone came to you and they've got wrist pain, what kind of questions are you starting to ask them? Or are there any other conditions that you might start thinking, actually, it might not just be the push-ups, it might be something else. Like what's kind of going through your mind with that wrist pain?
I guess there's many conditions that can affect the wrist. I think the first thing we'd look at as health professionals is how are you doing the technique? Because often wrist pain comes from, this overextending. And, I say this because I'm guilty of it. And Steve's many times watched me bench press and I'm like this. And he's like, mate, just how about we do this? And you're like, oh, okay. And then all of a sudden my wrist pain starts to dissipate. So we'd often look at that form and that technique, but then, yeah, absolutely. There are conditions that can definitely affect the wrist, and I guess that's where a comprehensive history can help really define is it the actual wrist itself, or is there an underlying systemic condition that we need to address?
Yeah, I think the big one that comes to mind whenever someone's presenting with wrist pain is, or they often tell me that it's it's carpal tunnel. It's carpal tunnel in my wrist, and then we start asking questions and we go, so your carpal tunnel is only aggravated when you do push-ups? Okay, interesting. So then we go, all right, is there something happening here that's compressing the area? Because we know that the load's going right through here. Then we could start looking at this image here where we see so many bones and ligaments in this area. And we go, okay, is it the carpal tunnel being compressed? Maybe. Do you have carpal tunnel symptoms such as weakness in your fingers? No. Okay, well maybe not. Then we go, all right, did you sprain a ligament in your wrist? Did you strain a muscle in your wrist? Did you hurt one of your bones in your wrists? Maybe. If I push and prod it around, does it hurt? No. All right. Then we start to this almost reasoning. We go, all right, it's not this, it's not this, it's not this. All right, how are you doing the push-up? And then we find out that maybe you're lacking that wrist mobility to get your wrist to 90 degrees. And we go, okay, why is that happening? Why can't you get your wrist to 90 degrees? And then we find out something's happening in the shoulder, something's happening in the body. So we definitely need to go through this assessment to find out, all right, is it this? Or is it something else that's happening in the body that's not letting you complete that movement? Which I think comes back to we need to get an assessment done to make sure we can confidently say what's happening in the wrist.
Absolutely.
Let's move on to last one here, case study number 5, where we've got mid-back pain, and the pain increases with arm and neck movement. So let's say around this T4 area, someone comes to you, they've got that mid-back pain, it's really localized to this kind of area. Like, what kind of things are you starting to think about around this T4 area?
Boy, there's a lot, because there's a lot of muscles that will come from that mid-back area, and they go up into the neck. They play a role with moving the neck and stabilizing the neck, and as well as with arm movements, that shoulder blade, I guess, plays a role in how we move our arms. And there's a lot of muscles that go from that shoulder blade into that mid spine area. So yeah, it's really having a look at those muscles or those joints and those ligaments in and around that area to see, okay, what's causing this? And I think it's very dependent. It's like, okay, is it a specific neck movement that causes that mid back pain? And you go, okay, maybe it's coming from the neck and it's causing this, or do we push on that spot in there and all of a sudden it's the neck that's radiating? It's like, okay, it's really focal to that area. Or we want to rule out something that might be a little bit more sinister, because you go, well, it's really mid back, but you're getting arm and neck pain. Is it your heart? Now with movement, probably not, because I've never seen a heart attack that you start moving your arm and the mid back and that's really it. You'll feel it quite constantly. But they're things we need to rule out, right? So you would never just go, well, we're moving and it's fine and we're not going to think about it. No. It's in there. It's a thought. We need to rule it out. But, we will have a look at the whole body, the whole system.
Yeah. I think that's definitely a tricky one, because it might be as simple as, hey, it's just your posture, how you're reaching over and you've just got really tight, muscles in this area. Okay. It could be that, you might have sprained this joint here, which is the kind of where the rib joins into the spine. All right, maybe. We don't like to use the word your ribs out, but maybe you might have sprained that area, and we might need to find the reason why that rib was working harder than before. Or it could be even kind of what you were saying, where something's not quite right. It could be the heart, it could be the lungs, it could be something systemic that is presenting itself as back pain. You might have been masking it for ages, forever. You've been just kind of like, oh, it's just dull pain. It's just my posture. It's just, the way I move. But then we find out there's something a little bit more serious happening. So it's something I think definitely we need to go and get checked out. Especially if it's being aggravated by lots of different structures. We go, okay, like what is it? Is it because this scapula is like sliding over it? Is it a muscle that's pulling it? Or do we have a restriction in some area of our body, such as our ability to twist, which means that the rib head has to work harder to twist. So definitely gets complicated. Lots of things to consider, which is why I think we should go get checked out. Well, Mick, we made it to the end of the presentation. I think
we've done well.
The summary points here is that if you are experiencing any pain in your body, I want you to go get checked out. I want you to go and find out, working with a registered allied healthcare professional, work with them to find out what's happening in your body. Is it something that that doesn't require further investigation? And then can you find out the why? Why is this happening in your body? And then, what steps can you take to help yourself with your body movement? Any closing thoughts?
No, absolutely. I think we've highlighted that, with many different case studies, there could be many different causes. So you're always going to be well taken care of if you go and see an allied health practitioner, and that could be, a physio, chiro, an osteo, a myo. And look, if you're not satisfied, the great thing is there's many practitioners, so you can always go and get a second, third, fourth opinion, and find the person that really works for you and resonates well with you and helps you understand and gives you a plan to really deal with any niggles you may have.
Awesome. Michael, thank you so much for being part of this presentation.
Thank you for having me.